Thank you, everyone, and good afternoon, and thank you for joining us today. We're proud to announce the latest step in the MTA's nation-leading response to COVID-19. Starting tomorrow, we're expanding our employee vaccination program to the Jamaica Central Control. This is the MTA's third new location in a month, the first on a Long Island Railroad facility. Mobile Health has been a great partner and will continue to serve as our health provider for this vital program. Getting this site up and running was truly a team effort. This program wouldn't exist without the dedicated hard work of our corporate safety, government affairs, operations, facilities, security, IT, human resources teams, all working alongside together with department heads who have been integral with logistics and scheduling. And thank you to each and every employee who has been part of this life-saving effort as we work together to keep everyone safe. And I'd be remiss if I don't mention our labor partners who have played a vital role in communicating with our employees and helping us to get them all vaccinated. Anthony Simon, who's here with us today, will be speaking shortly. General Chairman of SMART UTU went even further and worked tirelessly to secure additional vaccine shots for both Nassau and Suffolk counties, resulting in nearly 900 shots for employees in addition to the program at MTA. So thank you, Anthony. And with that, a big thank you to Nassau County Executive Laura Curran and Suffolk County Executive Steve Ballone for their leadership in making the vaccine available to the public and to our employees. Also joining us later to speak, Kevin Sexton, General Chairman of the Brotherhood of Locomotive Engineers and Trainmen, and Nick Peluso, National Representative of Transportation and Communications Union. We thank them as well and our other labor leaders for their support. This new location here that we stand today, our own Long Island Railroad headquarters in Jamaica, will make it easier than ever for our heroic workforce to get their shots. This site will also be open to all of the MTA employees. It's been our goal from the very beginning to help every employee who's interested in getting vaccinated get the shot. Our incredible employees are doing important work as New York reopens, delivering essential service for those that need it. Their health and safety are our #1 priority. Here at the JCC, we expect to deliver 200 doses of the Pfizer vaccine every Friday. That's in addition to the 100 shots at the Javits Center and 200 more per day in Brooklyn and Grand Central Terminal. We're encouraging everyone to get the vaccine, whether it's their turn or not, or when it's their turn, I should say. Not only our workers, but the general public too. We're doing everything we can to see additional public transportation workers get vaccinated. However, our efforts are dependent on the vaccine supply and availability, which I'm pleased to see is moving in the right direction as it becomes more readily available. Having this hub at the JCC is bringing us one step closer to helping Long Island and New York beat this pandemic, saving lives while we help to support the economic rebound of the region. And I want to thank our partners at Mobile Health for helping us launch this new site. Mobile Health has a long history of serving New Yorkers and promoting community health, and we're thankful for their support. So now I'm pleased to turn it over to Anthony Simon, General Chairman of SMART.
Phil, thank you. We appreciate all that you have done and the support. This is definitely a great day for us as labor leaders to have our essential frontline workers being given the opportunity to take the vaccine. Obviously, there are a lot of people here that were vital in getting this done. We work together. That's how we get things done. It is essential that we get these shots in arms and that we keep the public safe as well as every single member of the Long Island Railroad. And today is a great step towards that goal, and we look forward to supporting it. I know Phil had mentioned our county execs who were excellent in helping us as a union get the shots in arms, County Executive Laura Curran and County Executive Steve Ballone. I personally have to thank two special people in my organization who spent hours and days around the clock making sure that this happened from my office, and that's Jay Valdemira and EJ Chino, who are here with me today as well. Did tremendous work in securing these shots with us. So thank you. Thank all the other union leaders here that stood by us, and we worked together to get this done. I implore everybody to get this shot, to keep you safe, keep your family safe, and keep the riding public safe. It's time. We need to do this now. So thank you.
Thank you, Anthony. Next up is National Representative of TCU, Nick Peluso.
Thank you, Phil. Thanks to MTA for getting this done, putting this together. First, I want to take this opportunity to honor 3 fallen TCU brothers here at the Long Island Railroad: Anthony Acolo, Kyle Faulkner, and James Houlihan. I encourage everybody to get this vaccination. We need to get some sort of normalcy back in our lives, and this is a goal and a step in the right direction. We need to protect our customers. We need to protect our families. We need to protect our colleagues. Let's get this back on track, and I appreciate everybody's time putting this together. Thank you very much.
Thank you, Nick. And now, Kevin Sexton, General Chairman of BLE&T.
Thank you, Phil. First and foremost, we did also lose somebody, Brother Mitchell Datz, and our thoughts and prayers go out to all those affected by this truly vicious virus. I want to thank the MTA and the railroad for getting this operation up and running. It is integral to getting back to some sense of pre-pandemic life. I want to encourage everybody to stay safe and get vaccinated. This is what's going to do it. So we got to get going and work towards getting that. And as time goes on, we're noticing more and more people want to go and get vaccinated. So I think this is integral to getting there. So thank you again very much.
Thank you, Kevin. Next up, I'll have MTA Chief Safety and Security Officer, Patrick Warren.
Thank you, Phil. The vaccination center at the JCC will be open Fridays from 8 a.m. until 5 p.m. We expect it will primarily serve Long Island Railroad workers, but it is available to all MTA employees who would like to visit this site. For our employees who are interested, they should visit the MTA vaccination portal and quickly fill out the questionnaire there. They will then be scheduled for their shot by their agency's staff. Like Phil said, we want to see as many workers as possible get the shot. To date, we've gotten shots in the arms of more than 21,000 employees. That's about 30%. That is just over 30% of the MTA population, which is a great milestone, but we have a long way to go. We want to see the numbers rapidly increase significantly. I'll remind our workers that they're not required to go through the MTA program. Under current distribution guidelines, they are eligible to get their shot at any of the city or state facilities and other vaccination centers. We recognize that some may be hesitant about getting the vaccine, but the scientific data has been definitive regarding risks. Specifically, the CDC and other health experts agree that that the availability of, agree that the risks are very, very low for the vaccine, and the people will be in much better shape when it's over. The safety and health of our workforce is job one for the MTA. Transportation workers who have carried the city on their backs, and this has been an extraordinary effort that they will continue to do. But we are not done. We are going to, if we are going to get back to normal, we need to do our part and get shots in arms and continue the legacy of great support to the community that the MTA has always done. And beyond the vaccine, the pandemic remains a crisis which requires all available tools to be applied. To this end, we need to use all the tools that we have, including the guidelines of wearing masks, social distancing, getting tested often, staying home if you feel sick, and avoiding unnecessary travel. Thanks again to the folks of Mobile Health for their partnership. Now I'll turn this over to Mobile Health Chief Sales Officer Jim Anderson.
Thank you, Pat. I'm incredibly proud to be part of this vaccination initiative to protect the city's transit employees and get us back to a state of normalcy. My name is James Anderson, Mobile Health's Chief Sales Officer. Mobile Health is New York City's occupational health provider. For the last 37 years, we've been providing services to the businesses and patients across New York and the surrounding area. Disease testing and prevention is what we do. However, it is at our core to keep employees healthy. Over the last several weeks, the mobile health team has worked with some amazing people here at the MTA to create an even more incredible program. We are vaccinating our city's heroic transit workers, and now, continuing our great partnership with the MTA, we're expanding that program once again to include a vaccination site here at Jamaica Station. We're working hard to increase the overall numbers of vaccinations provided to MTA workers, and this is another step to ensure that happens. On behalf of Mobile Health, we want to thank the entire MTA team for this great partnership. Mobile Health is incredibly proud to service the MTA employees as we look forward to moving New York City to a healthier State of the Union. Thank you.
Anybody have questions? Anybody here? Well, thank you very much. Stay well and get the shot.
For those watching on the live stream, we're going to have vaccinations now right over here. We're going to have several employees be the first to be vaccinated at this location. Going to come up right here. We'll put it on the live stream.
Behind the camera there would be preferable. if you can.
Willie, I used to have biceps like Willie.
My legs are half the size of that.
40 years ago. Thank you very much.
You're welcome. 1 second.
Thank you very much. Thank you.
Willie, I have no lollipop.
Jody.
Good job, brother.
Thank you, thank you.
What I like is the sequence.
Looking away.
said it wasn't gonna hurt. That's what's going on. We'll put the little thought bubble.
didn't mean to